kedua, baris kedua itu, monggo lewat sini apa Pak? Di baris kedua, monggo. Mulai ada di rumah setengah Maret nomor
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Salam sejahtera, salam sehat, salam bahagia untuk kita semuanya. Terima kasih telah hadir pada acara pada hari ini. Yang terhormat Wakil Dekan Bidang Akademik dan Kemahasiswaan, yang kami hormati para narasumber, Dr. Arjan Schröder, M.D. Ph.D, dan juga Dr. Roni Triwirasto Sp.KJ yang saat ini masih dalam perjalanan. Kemudian yang kami hormati moderator kita, Dr. Winengku Basuki Adi, M.Med.Sc Sp.KJ, dan juga seluruh peserta lunch discussion hari ini, baik yang hadir secara luring di Gedung KPTU maupun secara daring melalui Zoom meeting. Selamat datang di lunch discussion pada hari ini, periode Juni 2025 yang diselenggarakan oleh FK-KMK UGM. Acara hari ini mengangkat tema yang sangat relevan dengan kehidupan akademik dan juga profesional kerja kita, yaitu Impostor Syndrome. Is it normal to feel this? Sepertinya menarik sekali ya. Apakah Bapak Ibu sudah mengetahui impostor itu apa? Pasti sudah banyak yang googling dulu ya, impostor itu apa sih? Menarik sekali, dan acara hari ini semoga menjadi ruang diskusi dan juga dapat menjadi ruang reflektif dan inspiratif bagi kita semuanya. Baik Bapak Ibu yang berbahagia, marilah kita bersama menyimak sambutan yang akan disampaikan oleh Wakil Dekan Bidang Akademik dan Kemahasiswaan kepada Dr. Ahmad Hamim Sadewa Ph.D. Kami silahkan.
Baik, terima kasih. Selamat siang. Assalamualaikum warahmatullahi wabarakatuh. Yang kami hormati, especially for Arjan Schröder, M.D. Ph.D. from Vrije, Amsterdam. Also our speakers, Dr. Roni, we still wait for him. Also Dr. Wininku, thank you very much as a moderator of this lunch discussion. And also we have Dr. Prof. Denny as head of the medical program in our faculty. Also Dr. Yoyo as head or coordinator of medical health and prevention unit. Dan tentunya Bapak Ibu sekalian peserta atau partisipan pada acara lunch discussion pada siang hari ini. Pertama kita panjatkan puji dan syukur kita dari Allah Subhanahu wa Ta'ala, Tuhan Yang Maha Esa yang telah memberi kita kesempatan bertemu untuk lunch discussion yang tahun ini edisi ketiga tidak salah ya, kedua atau ketiga untuk tahun ini yang merupakan acara rutin. So Arjan, so lunch discussion is a routine programs of our faculty. This day we will have Impostor Syndrome, but before we have any or many topics for that lunch discussion. Last year we have many topics on bullying, yeah, also mental health, yeah, because 2024 we find many case of mental health and also bullying in our faculty. But this year, especially in this lunch discussion, the topic is Impostor Syndrome. As we know that, ya sebagai seorang yang memang berkecimpung dalam bidang akademik, kita memahami bahwa dalam berbagai hal kita akan banyak sekali tergantung pada orang lain, bahwa kita akan belajar ya, akan belajar dan menerima ilmu dari berbagai pihak, dan bahkan juga dalam hal tertentu kita seperti menjadi tergantung ya pada ketergantungan pada orang lain yang tidak kita rasakan. Jadi topik ini sangat menarik ya. Dulu we have a topic about the procrastination. Yeah, and that's very important and very interesting topic ya. Many students attend that procrastination topics and ask many questions. So we hope also hari ini kita ada topik menarik juga ya. Silahkan feel free untuk menyampaikan berbagai pertanyaan, dan nanti baik itu Dr. Roni juga Dr. Arjan akan mencoba untuk menjawab dengan sebaik mungkin. Dan tentunya ini kita harapkan menjadi manfaat yang besar untuk kita semuanya. Harapannya apa yang kita dapatkan bisa menjadi bekal kita nanti dalam menempuh proses pembelajaran baik sebagai mahasiswa maupun juga sebagai dosen atau mungkin bahkan sebagai tendik, bagaimana kita bisa mengatasi hal-hal yang terkait dengan impostor ini. Mungkin itu, dan terakhir terima kasih untuk seluruh panitia. Ini panitia siapa ya? Bu Deni ya? Panitianya ya. Bu Deni, Pak Yoyo ya. Dan juga Mbak Mita, teman-teman semuanya, thank you so much ya for your effort to make this lunch discussion happen. Terima kasih, dan semoga sekali lagi apa yang kita kerjakan bermanfaat, dan mohon maaf kalau ada masih banyak kurang dan salahnya untuk acara siang hari ini. Terima kasih, selamat siang semuanya. Assalamualaikum warahmatullahi wabarakatuh.
Terima kasih Dr. Hamim. Baik, selanjutnya Bapak Ibu yang berbahagia, kita akan mendengarkan pemaparan dari dua narasumber kita hari ini yang luar biasa, dan tentunya untuk memandu acara pada hari ini, izinkan saya untuk memperkenalkan moderator kita, yaitu Dr. Winengku Basuki Adi, M.Med.Sc, Sp.KJ. Beliau adalah dosen dan psikiater dari FK-KMK UGM yang tentunya sudah tidak asing lagi di bidang kesehatan jiwa. Baik, berbagai karya ilmiah beliau di bidang kedokteran jiwa sudah banyak sekali dipublikasikan dan juga dipresentasikan di kancah nasional maupun internasional, dan baik berupa poster, literatur review, dan juga oral presentation. Baik, kita sambut moderator kita hari ini, Dr. Winengku Basuki Adi. Kami persilahkan.
Ya, thank you for having me. Thank you Pak Amim, Prof. Denny, Dr. Yoyo. Yeah, so today It's good to see you again, Dr. Arjan. Welcome back. I think you miss us, don't you? Yeah, today we will have so interesting topic about the imposter syndrome. And then this topic will deliver by two experts. The first one is Dr. Arjan and the second one is Dr. Ronnie. So without any further ado, the time and the stage is yours, Dr. Arjan. Enjoy the content for everyone in this place or in the online as well. So enjoy the content. Thank you.
To do test. Yeah, you can hear me? Yeah. There it is. It's great to be back again. Thank you, Professor Denny and Professor Amin for this opportunity. We're going to talk about imposter phenomenon. I think this is a really important topic we should know about to recognize, and it's related to perfectionism, the talk I gave in October, and also to procrastination. We'll discuss it in this talk. Well, a little bit about myself. I am a coordinator of professional behavior, professional identity formation at the Vrije Universiteit, Free University. But I'm also a psychiatrist and deputy director of the psychiatry residency program at the Mental Health Institute. So I like the combination of these two. In my talk, I'm going to use a few questions from Mentimeter. So if you scan... Yeah? Lebih bagus? Hello? Yeah? Okay. So if you scan this code with your cell phone during the talk, I have a few questions. And these are questions you can answer anonymously. Yeah? So I'll wait for you to scan this code. You can also go to menti.com and use the code over there. And I don't think maybe you see the first question already? I present away? Okay, yeah, perfect. Selamat datang, Pa. Yeah, okay. Okay, the first question, and this is a question for all of you, try to answer it yourself. This is about yourself. Try to be honest when you answer this. I often compare my ability, so what I can do, to those around me, and also think that maybe others may be more intelligent than others. Here's the QR code again. Are there also people online watching maybe? I'm not sure. They can also scan it. Okay. So a large majority answers this question with yes. Second question. People around me think that I am more competent than I really am. So other people think that I'm smarter than I think about myself. Try to answer this honestly for yourself. And it's anonymously. Ten more seconds. This is a lot, but it's recognizable. Okay. So, I'd like to discuss with you 3 questions which I think are important to ask yourself in medical training, but also in academic training. The first question is, who am I? The second question is, who do I want to be? And the third question is, what do other people think, who am I? Who do other people think I am? And if something went wrong with the slide, doesn't really matter. If I ask these questions to myself, now at this age, I sort of know how to answer this. So I'm a psychiatrist. I'm a coordinator in professional identity deformation. I enjoy combination of patient work, research training, but I also have a husband, I have children. I'm part Indonesian, part Belanda. I'm a curious person, so that's why I'm here again. I like to learn languages, etc. So I quite know pretty well who I am, but it wasn't always like that. So I'd like to take you back to the period when I was still a co-assistant. And during my co-schap in the Netherlands, and maybe also here, you have to give a lot of presentations. So when you're in the internal medicine department, you have to give presentations, and also in the psychiatry and surgery. And I was always very anxious for these presentations. And because you're there in the department, and there's the staff, all these bright people, and they're maybe going to ask you questions, and they have a lot of knowledge. And I had 2 ways of preparation. Sometimes I would just procrastinate, avoid, and on the very last moment, I was like, oh, tomorrow I have the presentation, and rush. And then when I have the presentation, I was like getting anxious, and like, oh, hopefully they're not going to ask me difficult questions. And sometimes I would prepare really well, and like trying to look up everything, all the little details, just to make sure that they couldn't give me questions that I couldn't answer. But I was always very anxious, like, oh, maybe they're going to find out something I do not know, and I will feel really miserable. What was happening? I had symptoms of imposter phenomenon. Well, what is imposter phenomenon? Imposter phenomenon was first described already in the 70s, and they found out first in women, because that's when women started to make careers, and they started entering the world where a lot of men were working, and women described these feelings of having doubt and uncertainty about what they were able to do. They had to compete with all these men, and that was the first description. So when you're suffering with imposter phenomenon, you have doubt and uncertainty about your own abilities. And you have the feeling that you're imposter, you're fake. And I think in Indonesian the word is penipu. And you have the fear that they're going to find out that you're not worth it. These 3. Doubts, feeling uncertain, feeling an imposter, and the fear of being found out. And what's the strongest indicator when you have this self-doubt about whether you're intelligent enough and whether you're able to do these things? Well, what are the characteristics? What's the behavior of imposter phenomenon? Well, people who suffer from imposter phenomenon, they work really hard. They can work really hard just to make sure that other people will not find out, make sure they don't make any mistakes. But they can also try to not stand out. I also remember when I was a co-assistant, like, I'm not going to ask questions because maybe it's a stupid question, or maybe they're going to ask me a question back and then I don't know it. So like, well, maybe keep low profile. Avoiding, procrastinating, that's also some sort of imposter phenomenon. Feeling inauthentic, so not feeling authentic, like feeling fake. Like, oh, I'm pretending to be this co-assistant, but maybe I don't feel real. And using charm. Some people are like, well, I need my social skills, making fun, making like jokes, trying to be social, but trying to focus not on the intelligence. And this is important, the inability to eternalize success. So when you're successful, so when you pass an exam, or when you get a good grade for a presentation, You can think like, wow, it's because I put a lot of time in it. Not because I'm smart, but because I put a lot of time in it. But it could also be the other way around. I was just lucky they didn't ask me these difficult questions. I was just lucky, and that's why I passed, but I'm still not bright. Well, how do you recognize imposter phenomenon symptoms in yourself? You might, and I underline might, you might have symptoms of imposter phenomenon if you're always having doubts about your success. When you're feeling you are not good enough. You pass the exam, you're still like, I'm still not worth it. And you have the fear of disappointing others. What would my friends feel? What would my parents think about this if I fail this exam? I cannot disappoint them. I cannot disappoint my family. And when you get a compliment, they say, well, you done really well. You're like, doesn't feel like it. Or physical complaints, headaches, fatigue. These can all accompany these symptoms. And once again, you might have imposter phenomenon symptoms. Okay. Question number 3. The imposter phenomenon is officially a DSM-5 disorder diagnosis. Yes or no? The psychiatrist and the residents should know this question. Feel the pressure. Ten more seconds. Maybe some people are looking it up on a cell phone. That could be. Well, the correct answer is no. It's not in the DSM. But doesn't mean that the DSM is like the best book there is. It's just a manual. Doesn't mean it doesn't exist. Okay. Imposter phenomenon and health. What kind of health complaints can people have? Reduced job satisfaction. You can imagine if you work in a place where you feel stressed all the time, you feel assessed all the time in a hospital or in a university, you have more problems with enjoying your work. There's more workaholism. If you know you have to work hard all the time, you don't want to make mistakes, it will lead to workaholism. Stress, burnout, self-confidence. When you have these doubts about yourself all the time, social anxiety, depression, even suicidality. All these things are related to imposter phenomenon. It's pretty serious. Okay, who's at risk for imposter phenomenon? Well, it's not really a surprise. It's the medical world. And we'll get to why that is later on. When you look at medical students, a quarter to almost 60% of the medical students suffer from imposter phenomenon, and like 25% suffer from severe imposter phenomenon. And it's more common, and there we have it, in women. When parents have a low education, lower than the bachelor's degree, or low income family background. And this has probably to do with when you enter a different world, a different environment, with people who have a lot of knowledge, and you feel like a minority. So if you're the first person in your family who's going to study, if your parents have never studied, or they're from poor background, and you come to this world where you have all these rich people who have parents who went to study, you can feel a little bit more inferior, and that can be a breeding ground for imposter phenomenon. But so cultural ethnic minorities, and that's actually internationally proven. It's like that. So we see that in the Netherlands also, when there's like students from Moroccan or Turkish background, and they're the first ones in the family going to university, and they enter this university full of white, highly educated people. They can have these feelings like, oh, I gotta work really hard. I gotta aim for that level. I cannot disappoint my parents. So all these factors play a role in the imposter phenomenon. Young academics and postdocs. So in the academic world, when you're just starting your career, that's also a breeding ground, because you have to compete with all the others. We'll get to that later. And certain forms of perfectionism. Okay. Question number 4. Why is the academic and medical world a breeding ground for imposter phenomenon and perfectionism? So why do you see that more often in these environments? Is it coming? Yeah. You have to look at the cell phone, then you can see the... yeah. So take your time to answer this question. Well, you guessed right, or you thought right. This is the right answer. It's an environment where there's a lot of pressure with high standards and a lot of competition, both in the academic world and the medical world. Still people answering, but I already gave away the answer. That's not fair. So the medical world is a breeding ground for both imposter phenomenon and perfectionism. Why is that? In the medical world, it's important to avoid mistakes. And I always like to give the example of a surgeon. I prefer a surgeon that does not make mistakes. I prefer a surgeon that's preparing his operation. You can imagine when somebody enters the operation room, like, okay, what are we going to do today? Oh, it's going to be the brain. Oh, that's been a long time I did the brain. You want to have somebody who avoids mistakes. You want to have somebody to be prepared. There's a lot of competition in the medical world. Publish or perish. You publish your new research, or you perish, you disappear. A lot of that's the world we enter as a doctor. Pengawasan, there's a lot of scrutiny, control. And that's also a world where there's more negative feedback. You did this wrong, or you did that wrong, or when you write a paper, you get all these crosses like this is a wrong sentence, etc., etc. There's prejudice. Like in the Netherlands, you can tell by the accent where somebody comes from, and you can tell like he's from a big city, or he's from the rural area, he's from the south or whatever, and there's still some prejudice in languages or the way somebody looks. Sometimes it's very open, somebody is very covered, but it's also so this also plays a role. It's a white coat culture. So I also think when you're going to the hospital and you put on your white coat, it also feels like, oh, now I'm gonna change into that role of me as a doctor. It's almost like going to play in a theater. Like I put on my clothes and now I am the doctor. And when I take off my clothes and my white coat again, now I'm the ordinary person again. So that also creates this distance between who you feel and how you perform. And it's still a male culture, although that's changing a lot. At medical school in the Netherlands, I think like 60% of the students is female now. So that will also actually help with this. Okay, how does this imposter phenomenon develop in medical training and academic training? Well, in medical training, it exists especially in supervision situations. So when you're, as a co-assistant, you're at the outpatient clinic and you see the specialist or the resident doing the examination, and then you are going to have to do the examination, you feel supervised, you also feel watched. So you're really aware of what you're doing, and it's like somebody's controlling you, and like, oh, I cannot make a mistake. So the whole situation of being supervised directly, that creates more imposter feelings. Because you're also assessed, and they're like, well, this is wrong, this is right, and you get maybe a grade right afterwards. So the situation of being in direct supervision creates these emotions. And this is an interesting paper by Hutchins, because Hutchins described what kind of incidents can occur that create imposter feelings in people in academia. The first one is academic productivity. When you're in academics, you have to publish, you have to write proposals for grants, and you get rejected, or you get your proposal back with all these complaints. So there's a lot of focus on how much output you get. And these focuses on output can create these imposter feelings. That's one factor. The other one, the second one, it's going to be 4, comparison with colleagues. You see the other colleague who's got a new grant or got a new position. And then whether you like it or not, you're like, wow, you start comparing yourself to the other person, or the other person gets compliments. You're like, oh, maybe I should work harder because I have to get this grant too, or I want to write this paper too, or etc., etc. This incidents like this also create more imposter feelings. Questioning expertise. It can also be when you're giving classes and you get all these questions from students or colleagues, and you're like, oh, these things I do not know. I'm not smart enough to be able to answer these questions. Or maybe it's more open, that people ask like, wow, I don't think you know a lot about this. So these moments when you are asked a lot of questions and you start having doubts about your expertise, that can also create imposter feelings. And the fourth one is success. People with, when you're in academic world, and you get like a success, like a new paper, new grant, like, oh, can you be really happy about it? Can you shout it out, or you have to be modest? Are you really worth it? So when you get success, a new position, it can be difficult to celebrate it and also increase these feelings of imposter. So this is what happens in academia, but also in the medical world. There are male and female differences. I'm not sure if it's the same in Indonesian culture, but what we know is that women are more active and are better at talking about emotions. So women, when they have a rejection or have problems with their self-image or about imposter, they'll ask for help. They talk to their colleagues. They ask for advice. How should I do this? How should I do that? So they're more actively coping with it, and they ask for emotional support. Men avoid. They don't talk about emotions. They don't talk about problems. They don't show that they feel miserable about failure. That's like a general distinction between male and female coping mechanisms. Well, a little bit of perfectionism. This is what I talked about in October. Perfectionism in medical doctors. Well, doctors score high in all sorts of perfectionism measures, and burnout is highly associated with perfectionism. And a quarter of the medical doctor, the young doctors, the residents, have burnout complaints. And at when you look at medical interns, the majority of them spends more time on their kooschap than they initially planned. So they enter an environment where a lot of people are working hard, making long hours. So that's where they learn, like, oh, I gotta work hard too, because that's what everybody does. I cannot go home early, I cannot be unprepared. So it's an environment that creates these this overworking. Okay, what we know about perfectionism and an illness, it increases a lot of the risk for a lot of mental disorders. And it's not only mental disorders, it's also physical somatic disorders. And there's a lot of meta-analysis done on the relationship between perfectionism and all these disorders. Okay, this is an interesting study. Curran and Hill did a really large study, about 40,000 students, and every year they would ask the new students to fill out these forms of, about perfectionism. What you'll see here is that the students in 1990, 95, they score lower on perfectionism measures than the students who filled it out later, like 2010, 2015. So it's not a longitudinal study, it's a cross-sectional study, but every year the new students are more perfectionist than the years before. It seems to be that perfectionism is on the rise. Question number 5. Why is it increasing in society? What do you think is the reason why perfectionism is increasing? Is it because of better access to education, more interest in self-improvement? Is it because of more pressure? Or do we have more free time and lower expectations? This could also be like peer pressure. That nobody dares to answer a different question. That's actually interesting. But it is the right answer. It's because the rising pressure to be perfect in society and in culture. That's true. You answered correctly. So why is it increasing? Well, you could think maybe it's genetic. There's a genetic influence. So maybe the perfectionism in which you aim really high standards, that is something you're born with. But the perfectionism in which you are really thinking about what other people think, the pressure from others, that might be something you learn as a child from your parents. But that's not the case. All sorts of perfectionism have the same genetic loading. Society factors. When you look at the website of the Free University, they're really proud to show you that there's a high quality research and they have excellent performance on international ratings. And also when you go to the Gajah Mada, you cannot get into Gajah Mada with low grades. You have to do a special test to get in. So only the people who work hard, are bright, those are the ones who get into medical school. So you already have a screening for that. Well, social media. There's more and more research coming out about the influence of social media. And what we see is people who score high in perfectionism, they have a bigger chance of a lower self-esteem. There's, especially in women, there's more dissatisfaction with weight and appearance if they're if they see all these images of perfect models on Instagram, especially the ones with perfectionism, they get more dissatisfaction with their own appearance. And there's a bigger chance of having depressive symptoms when you're a perfectionist because of social media use. So what kind of perfectionism do we have? We have healthy perfectionism and unhealthy perfectionism. Healthy perfectionism when you're striving for excellence, not perfection. So you can aim high, that's okay. That's not necessarily unhealthy, as long as it doesn't include the word perfection. And when you're organized and structured, that's okay too. Well, what about unhealthy perfectionism? Unhealthy is when your goals are really strict, very rigid, and actually unrealistic. So when my students, I tell them like, well, I don't think it's realistic to say, I want to become a professor. You can have to dream, but to set that as a standard, And of course, some of them will become professional, but it's better to aim for smaller, more concrete goals. Like I want to become better at physics. I want to become better at like cardiology, like physical examination, things like that, or passing a certain exam. But they have to be more realistic, more concrete.
5 more minutes.
5 more minutes. Oh, we're gonna be okay. I'm gonna make it. Then when you have doubts and fears about making mistakes, and when you avoid a lot, and when your self-worth is depending on what other people think, and perfection. Well, when we look at these three, if we look at these factors, these extremely strict goals, doubts, and being busy with what other people think, these are actually imposter characteristics. This is why they're related. It's the same. Okay, what can we do about imposter phenomenon? Well, you can look at the individual, you can look at the supervisor and colleagues, and the system, and of course they're all connected. Well, individually, what we can do is, first of all, recognize your own imposter feelings and perfectionism. And that's why we have this talk. Focus on the positive. So remember, learning is a process. It's okay to make mistakes. But that's also something that we have to do in the system, but also important to have it individually. Practice self-compassion. Students are very negative in the words they choose to talk about themselves. They say, oh, I'm a failure, I will never make this. It's better to say, like, I'm not good at this yet. So the words you use are important. And ask for support when needed. So ask for help. I think that's actually a sign of strength when you're asking for help. Well, and supervisors and teachers, they have to be aware that imposter phenomenon and perfectionism, especially in the medical world, academic world, can play a role. So you have to create safety and openness and lead by example. This is probably something else also do. Know where somebody comes from, know where somebody can struggle with. And just like in the beginning, when I talked about individually, learning is a process and you can make mistakes. And struggle sessions, we discussed it during lunch. That's what we have in research groups. When there's a meeting, an informal meeting, where everybody, including the supervisor, can discuss things he struggles with, like a certain paper he's writing, like the next paragraph, I have problems writing it down, I can't find the right words, or having a statistical analysis. So having these meetings where everybody can be informally invited and talk about these problems, that can be really helpful. Celebrate effort and progress, not just results. It's easier said than done. I use verbs, not nouns, but I can give you all the different class on how to give proper feedback. And have fun together. And at the Institute, well, these small group sessions can be really helpful, like the struggle sessions. I think the smaller the group, the better it is. It's more safe. Well, this is the same thing. Mistakes are okay, and asking for help. This is something we also have to facilitate. And we have professional identity development programs. This is what we have in also in our medical faculty. Also for students, actually. Students who are having doubts about continuing their master phase, we have a special career officer that can help them try to find a different path. Okay, well, I'm going to wrap it up. I have 1 minute, I think. 2 minutes, okay. Important lesson for my co-extend period. So remember the 3 questions I was dealing with, and 3 questions I think are important. Who am I, who do I want to be, and who do others think I am? An important lesson came when I was doing my internal medicine rotation, co-extend. The supervisor came to me and said, Arjan, we need to have a talk. I was really scared. And he said, I want to give you feedback on what I think is happening to you. And he said, people have a problem actually understanding whether you like it or not, whether you enjoy the co-schap. Because sometimes when you get a question and you don't know the answer, you seem to be acting indifferent, like you don't care. But I don't think that's the case. I think you really do enjoy it, but you think you're having a difficulty accepting it. But you have to be aware of how you appear. And I was kind of shocked that he said it to me, but I was really thankful. He said, everybody has his own learning curve. And it doesn't matter what your curve is, as long as you know that you have your own path. And I was really happy that he gave me this feedback. So he said, you have to be aware of this, and you should know when to ask for help. If you have a problem with a presentation, ask one of the staff members to help you with the presentation. If you have problems presenting, ask somebody to help you prepare and prepare his preparation. All these little things, but you have to be aware of your own path, and that's okay, and you don't have to be perfect. And I was really happy with that feedback, because he knew what I was struggling with, and he showed me that it was important to be aware of these struggles, and it was not a problem. So I'm still thankful up till today that he gave me that feedback. And then I became this person. And this is actually interesting, because also ChatGPT has a bias, because when I ask this ChatGPT, give me a doctor in Amsterdam with imposter phenomenon, he gives me this male image. And the same as the previous image, give me an Indonesian doctor, medical doctor suffering from burnout, he gives me a male doctor. So ChatGPT is kind of biased still. So there's a lot of improvement to be made. But thank you very much. I'm going to give you the take-home lessons summary. Imposter phenomenon, we talked about what it is. It's doubts about intelligence and ability, and the fear of being exposed as a fake. It's connected to mental health problems and perfectionism. There's a high prevalence in the medical world and academic world. And we need to address it both individually and in the system. We have to recognize in ourselves and in others. And most important, you don't have to be perfect to be a good academic. My slide is gone, but that's okay. Terima kasih.
Okay. Thank you, Dr. Yeah, thank you, Dr. Arjan. Nice presentations. So we now exactly what is the imposter syndrome, from the characteristics until how, and related to the perfectionism as well. And you just explained about the physical complaint related to the imposter phenomenon. And now we jump to the next topic that will delivered by Dr. Roni. It's related imposter syndrome in the working place field. So everyone, please hold your questions until we jump on the discussion sessions, right? So after Dr. Roni's session, we will have a discussion, and then you can raise your question on that sessions. Thank you. And now, Dr. Roni, the time and stage is yours. Thank you, Doctor.
Terima kasih. Ya. Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for the time, and Dr. Arjan, nice to meet you. It's very happy to have you in here. It's your second time, right? It's your second time. The first we met in secondary ward. Okay, it's very happy for us. Profesor, dokter, saya akan membawakan dengan bahasa Indonesia, karena saya lihat di beberapa, tidak semua, ada beberapa juga yang staf dari teknik ya. Jadi ya saya akan berbicara dalam bahasa Indonesia saja, biar sama apa yang bisa saya sampaikan nanti bisa sampai pada Anda semua. Okay. Slide-nya Mbak Tina Pangi. Ya, baik. Oke. Impostor syndrome sudah diterangkan oleh Dr. Arjan. Have you introduced yourself? Already? Okay, sorry, I missed it. Kami pernah bertemu di Bangsal Jiwa waktu beberapa bulan yang lalu. Beliau juga memberikan kuliah di sana. Oke. Tadi ada Pak Wakil Dekan, kemudian Bu Prof. Denny, sudah kondur mungkin. Baik Bapak Ibu sekalian, Mas Mbak sekalian, saya akan berbicara tentang Impostor Syndrome di lingkungan kerja, bagaimana pengaruhnya terhadap kinerja dan prestasi. Nah, pada dasarnya kalau kita bicara masalah impostor, kita nanti akan teringatnya pasti akan di sini gitu. Ya, ini sebenarnya mainan 10 tahun yang lalu. This is my children game 10 years ago, Among Us. You can find it in the internet. Among Us, ya. Tapi di situ gamenya tidak seperti kemudian merasa tidak pantas, tidak. Tapi kemudian dia ada suatu tugas-tugas yang kemudian tugas-tugas itu dibajak oleh si ini, disabotase gitu, sabotage by this person, and then kemudian nanti akan ada suatu diskusi yang kemudian memutuskan bahwa kamu impostornya, kamu harus keluar dari spaceshipnya, kamu harus keluar dari pesawat ini gitu. Nah, itu impostornya di dalam ranah itu ya. Jadi artinya bahwa ada suatu tekanan dari lingkungan yang menyatakan bahwa dia tidak pantas gitu. Kamu tidak pantas di sini, kamu mengganggu task kami, kamu mengganggu, you are not belong to us, you are not to be here, you are not deserve to be my group gitu. Because you are disturbing my task. Karena dia mengganggu impostornya itu memang mengganggu tugas-tugas dari yang lain. Ya. Ini permainan berkelompok yang kemudian kalau bisa impostornya itu 1, bisa 2, bisa 3, tergantung pada saat pertama kali ngeklik, kemudian nanti dapat siapa atau dapat apa perannya. Gitu ya. Impostor. Nah, ini outline saya, ada tidak banyak outline-nya karena tiap outline cuma 2 baris saja. Ya, jadi nanti kalau ini ada 1, 2, 3, 4, 5, 6, 7, ya 10 ya kira-kira 20 lah, 20 baris aja ya. Introduction, the concept of Impostor Syndrome have been talking by Dr. Arjan. Diperkenalkan itu just by 2 psychologists, Clance and Imes, describe high achievement women who felt undeserving of their success. Most of us here in this room, the men only 9. Bisa kita hitung ya, 1, 2, 3, 4, 5, 6, 7, 8, 9, tambah 1 lagi 10. 10, hanya 10. Jadi semuanya adalah woman with their success. Nah, ini semua kan sukses semua ini. Ya, sukses. Nah. Yeah. Right. Yeah, right. Jadi mungkin impostornya itu kami 10 ini, bersepuluh itu impostornya bagi woman with successful achievement. Ya. Tapi sekarang tidak, sekarang ini sudah dikenal oleh semua kalangan. Jadi semua kalangan. In modern workplace, impostor syndrome impact productivity, team dynamic, and mental well-being. Ya, bagaimana itu bisa terjadi nanti akan saya terangkan kemudian. Ya. Nah, definisi sudah, saya tidak akan mengulang lagi, tapi secara singkat bahwa impostor syndrome itu adalah suatu persistent self-doubt about one's ability despite objective success. Jadi keraguan-raguan pada diri gitu, merasa bahwa tapi ragu-ragunya nanti akan berbeda banyak ya, ada perbedaan keraguan-raguan pada inferiority, it's different with inferiority, the low self-esteem is very different ya, the impostor syndrome ini, ya, impostor fenomena, bukan impostor syndrome tapi impostor fenomena. Nah, common feature-nya adalah attributing success itu ada to luck or external factor gitu. Jadi ragu-ragunya kemudian saat mencapai sesuatu itu dia akan merasa bahwa itu ya ini adalah hanya kebetulan gitu. Ini ada faktor kebetulan. Nanti akan saya terangkan lagi di dalam koridor socio-cultural kita. Itu akan lebih menarik ya. Fear of being exposed as a fraud. Kemudian perfectionism tadi sudah diterangkan, you said before about the perfectionism in impostor syndrome, and fear of failure. Ini sering terjadi. Ya. Dokter, ini saya mau maju referat 1, ini judulnya apa ini? Ini judulnya begini, judulnya begini, judulnya begini. Gitu. Ini saya mengajukan 3 judul, dokter. Ini mana yang bisa untuk referat 1? Gitu. Apa ini? Ya, gitu. Kedua kali maju dokter, saya mau maju referat lagi, sudah doubt dulu, sudah ragu-ragu dulu. Gitu. Wah nanti lama ini, pasti kalau dengan dokter yang ini nanti lama, loh nanti dokter ini aja gitu. Kok ya masuk Zoom ya. Fear of failure. Tapi saya Mas Mbak sekalian, kalau yang bukan dari psikiatri ini sebagian besar karena ini psikiatri ya. Jadi saya pernah memang beberapa kali memang begitu. Ini judul nggak bermutu, it's not unqualified title gitu. Kalau dengan spesial dengan residen saya tidak akan bicara lebih keras, tapi kalau yang di S2 atau S1 gitu mungkin akan sedikit lebih keras gitu. Idemu kayak gini, mbok mikir sedikit gitu. Gitu. Maju kedua nggak berani, doubt, self doubt about the failure, ya, fear to failure. Ya. Nah, basic science in psychiatry dan psychological basis, ya ini impostor syndrome linked to the cognitive distortion. Kalau sudah ada distorsinya ya pasti sudah akan ada seperti ini ya. Neuroimaging ya saya tidak akan bicara banyak tentang ini karena memang ada basic science-nya lah impostor itu ya, merasa begitu ya. Dan ini biasanya koeksisten dengan anxiety disorder, depression, and maladaptive perfectionism. Tadi sudah dibahas perfectionism ya. Cuma kita tidak membahas ke anxiety, depression atau yang maladaptive tadi. Nah, sekarang ke socio-cultural. Siapa dari kita kalau nyuwun sewu nggih Bu Marni? Nyuwun sewu. Impostor syndrome tadi saya. Nyuwun sewu Bu Marni, impostor saya, impostor fenomena. Gitu. Padahal harusnya rendah hati itu kalau bagi kita adalah hal yang baik. Jadi humility is the positive way to show who am I gitu. Itu kita kan kadang we cannot differ between the impostor feeling or being humble gitu. Yeah, sometimes we do the being humble but it's not. Yeah. Padahal ya tadi seperti saya contohkan, nyuwun sewu Bu Marni, kenapa gitu? Karena saya merasa impostor tadi. Karena saya di sini berdiri di hadapan guru saya gitu. Ya, ini jadi kemudian ada seperti ini. Tetapi bedanya adalah pada humility, it's an adaptive trait characterized by an accurate, balanced view of oneself recognizing dengan strength, limitation without self-deprecation or arrogance. Ya. Siapa yang pernah ditelepon oleh nyuwun sewu oleh senior, kemudian sambil begini, saya contohkan ya. Halo, nggih dokter. Terus telepon loh di sini, lihat juga enggak itu. Nggih. belum lagi wah ini Mas Mbak sekarang yang nyuwun sewu yang berbaju biru, wah itu ditelepon kemudian siapnya sambil gini, siap baru duduk terus siap itu impostor. Tapi enggak, itu bukan impostor, itu artinya bahwa kita dengan accurate kita tahu bahwa itu sebatas itu gitu ya, sebatas itu. Nah ini socio-cultural. Kadang kita kalau ditanya, wah ini kamu bagus sekali nih kerjaan, wah ini referatmu bagus, dokter buatan namanya. Itu juga feeling rendah hati gitu, rendah hati. Ya. Atau dipromosikan kamu sekarang sebagai kamu sebagai chief resident. Oh enggak dokter, enggak. Itu yang lebih enggak, padahal itu ngendo sebenarnya. Ya cuma enggak mau aja gitu ya. Nah, tapi beda rendah hati. Itu ada pada culture kita. Ya, kita punya suatu culture, kita punya suatu budaya di mana menonjolkan itu sesuatu yang bahasa Jawa itu saru. Nah, Mas Win tugasnya membahasakan dalam bahasa Inggris saru niku nopo Pak gitu. Jadi saru itu menonjolkan sesuatu itu saru, apalagi sampai sekarang itu flexing itu saru. Saya masih ingat ya, saya cerita sedikit aja beberapa 25 tahun yang lalu ya, waktu masih suka jalan-jalan kemana-mana, suatu ketika saya makan dengan sahabat saya, makan tahu kupat waktu itu. Wah kalau makan tahu kupat sudah terbayang di kota mana dong, ya kan? Nah kan, Solo juga bisa, Kemudian saat itu ada rombongan, mohon maaf ya, saya bukan rasisme, bukan diskriminatif, ada rombongan eyang-eyang dan eyang-eyang kakung dan eyang-eyang putri gitu. Ya, tapi dengan celana segini, sepatu dan sudah yakin itu sepatunya mahal banget gitu. Gini kaosan gitu ya, beliau itu mereka itu terus masuk. Waktu itu naik panter hijau. Tahu nggih, panter hijau. Kalau yang di fakultas sudah enggak dipakai, Mas. Panter hijau itu. Wah. Sing soke belakang mati itu loh, panternya hijau itu kalau di fakultas. Mereka turun kemudian makan. Kemudian teman saya bilang begini, "Kamu enggak tahu itu. Kau tahu enggak itu Ron itu? Salah satu itu adalah ketua asosiasi suatu toko besar di Jogja katanya gitu. Cuma pakai kaos. Zaman dulu, humble, rendah hati. Itu kayaknya kayak apa gitu. Kaya banget. Saya pernah ketemu juga dengan seseorang yang mungkin nomor sekian terkaya di Jogja itu datang kemudian pakai sandal jepit, kemudian pakai apa namanya? Kalau kita bicaranya celana gojak-gajek dulu, sing 3/4 itu, 7/8 atau 3/4 ya, yang cuma nggih kados kula niku nggih, 7/8 begitu, kemudian pakai kaos, tidak pakai perhiasan sama sekali. Padahal kalau mau beli perhiasan itu setoko-tokonya sak Jogja itu bisa dibeli. Ya, humble, ya, itu adalah budaya kita. Tetapi kadang kebablasan. Ini impostor tadi. Ini perbedaan impostor syndrome dengan humility, ya. Self perception. Kalau impostor syndrome itu feel underserving. Saya tidak pantas. Tidak pantasnya dalam bentuk ya, kalau yang di psikiatri pasti sudah mengenal ya, antara dalam batas normal tak ada kelainan dan menuju gangguan itu kan sudah jelas ya. Nah ini kalau humility itu accept both strength and weakness, realistic. Jadi secara realistis tahu bahwa oh ya saya tidak mampu ini, saya mampu itu, tapi kemampuan saya itu tidak saya tonjolkan dan saya tahu bahwa itu saya adalah tidak menonjolkan saja gitu. Ya. Kemudian motivation source. Ya. Nah kadang impostor syndrome itu kemudian tampaknya itu kayak sopan tampaknya, padahal dia sebenarnya pada posisi anxiety, fear of failure atau self doubt tadi itu. Ya. Tetapi humility itu growth, learning, service, and self-improvement, itu pada motivasinya. Ya, tapi bukan kemudian seperti ini banyak ya, Jogja Solo kan di sini banyak nih ya, Jogja Solo. Nah, Jogja Solo itu kadang nggih itu di depan, tapi sebenarnya enggak di belakang. Ini ada fotokopian itu, Mas tolong difotokopikan 5 lembar, oh nggih. Nggih dulu di depan, tapi nanti di belakang, wah dokter ini ngomong jam semua ini. Enggak apa-apa, itu adalah kesopanan. Daripada langsung bicara di depan itu enggak mau dong, enggak bisa. Ya. Respond to praise, ya, denies or deflect praise, feels unworthy. Semua yang dilakukan itu kadang tidak merasa tidak pantas gitu. Walaupun sebenarnya itu adalah suatu hasil yang luar biasa gitu ya. Nah, praise itu menjadi sesuatu yang tabu kadang. Ya. Tapi kalau rendah hati enggak, kalau rendah hati adalah accept praise without arrogance. Wah ini bagus ya, penelitianmu bagus banget, udah jelas udah wong saya. Jelas bisa. Mosok kayak gitu. Gampang, enggak gitu juga, enggak gitu ya. Pengalaman yang pernah jadi koas-koas saya. Kemudian ada psychological impact ya, anxiety, stress, self inhibition, kemudian ada orientation ya. Jadi ini nanti yang berpengaruh pada apa? Pada dunia kerja. Kita semua di sini ada dunia kerja. Walaupun Anda belajar di dunia kerja, yang di dunia kerja jangan sambil belajar. Ya. Karena nanti bingung. Ya. Jadi biasanya kalau yang di dunia kerja, murni dunia kerja, kalau pengen belajar ya nanti terus cuti belajar gitu. Ya. Kalau dicampur jadi bingung. Yang kedua harus dibedakan. Second thing that we have to different between the impostor phenomenon is inferiority. Yeah, because inferiority refer to pervasive feeling of being less valuable. Inferiority become depression. It's one of the symptom of depression. Inferiority, not impostor syndrome. Yeah. Inferiority deep rooted sense of inadequacy or low self-worth, not necessarily linked to achievement or failure. Jadi apapun itu menjadi rendah diri gitu, apapun itu jadi tidak merasa tidak mampu gitu. Nah kalau sudah seperti ini ya, ini bukan lagi impostor, merasa tidak pantas, ya memang nggak pantas kamu di situ gitu, nanti jadinya begitu, ya. Bukan karena merasa tidak pantas gitu ya. Can lead a passivity, withdrawal, social avoidance, or overcompensation. Sometimes can lead to aggression. Ya, tadi siang saya baru diskusi dengan perawat terkait dengan fenomena agresivitas dan hiperaktivitas pada seseorang. Pada dasarnya, basically, aggression and hyperactivity is not only for the sensitive person. Sometimes from inferiority person. Inferior person with the feeling of anger itu bisa jadi aggression gitu. Sehingga kadang perilakunya jadi perilaku yang maladaptif gitu, karena inferiority. Oke. Di epidemiologi tadi sudah dibicarakan, risk faktornya adalah perfeksionisme. Makanya tadi kenapa dibahas terkait dengan perfeksionisme. Ya. Kenapa become to perfectionist is important? Why people you have to be perfect. You have to be perfect. Your result has to be perfect. Yeah. High self expectation, low self esteem, maladaptive coping. Yeah. From the social risk factor, minority status, lack of representation, stereotype threat, organizational, competitive climate, lack of support, emphasis, result of over process. Ya, manifestasinya dalam kehidupan kerja adalah overworking and inability to delegate. Nah, ini kadang-kadang loh ya, kadang-kadang. Tapi bukan berarti kemudian semua yang tidak didelegasikan itu adalah karena merasa tidak merasa tadi ya, doubt tadi itu, self doubt. Tidak ya. Tapi kadang-kadang begini, kalau yang di sini adalah pada saat kemudian di dunia kerja dia merasa bahwa pekerjaan itu adalah hal yang harus dilakukan. Dia tidak bisa membagi karena dia kalau dia bagi kejelekan dia itu jadi tampak gitu. Itu makanya inability to delegate. Berbeda dengan kondisi di mana dia tidak bisa mendelegasikan karena satu, tidak ada orang yang bisa didelegasi. Yang kedua, karena orang yang akan didelegasi itu tidak mampu melakukan pekerjaan yang selevel dengan dia. Beda. Ya, beda. Oke. Sampai pada difficulty accepting praise or positive feedback. Pada saat kerjaannya bagus, kemudian dia nanti dibedakan lagi nih sama begini, misalnya gini, ada penelitiannya bagus, kemudian dipuji nih, wah penelitianmu bagus, terstruktur, nyuwun sewu nggih Bu Marni nggih, nyuwun sewu. Benang merahnya, nyuwun sewu lho Bu Marni. Benang merahnya jelas dari depan sampai pada konklusi. Dipuji begitu. Tapi kemudian dia akan merasa bahwa enggak, itu pujian itu bukan untuk saya. Pujian itu enggak, tidak pantas saya menerima pujian itu kayak gitu. Itu tidak, itu difficulty accepting praise. Ya, jadi itu banyak sekali itu. Kejadian di dunia kerja banyak sekali itu. Oke. Nah kadang ini kalau yang jadi bos-bos ini ya, ini Mas Mbak yang jadi bos-bos itu kadang memberikan apresiasi itu juga tidak pada saat yang tepat, tidak pada orang yang tepat gitu. Sehingga yang terjadi orang yang menerima itu kadang kayak malah dinyek gitu. Ya, kayak di apa ya? Oh ini Pak kayak ngece kayak gitu. Misalnya, oh ini untung nggak ada Pak KKA ya. Tak roasting nanti. Teman, nggak apa-apa. Tendensi to avoid visibility, ya. Jadi seperti public speaking, kemudian project leadership, gitu ya. Di dalam budaya kita itu juga ada yang namanya pemalu, tapi ada dalam bahasa Jawa lebih spesifik lagi, itu namanya celingus. Oke, ini dari, oh iya kalau tadi Dokter Arjan half Belanda, half Indonesia. Kalau saya half Sumatera, half Jawa, sama-sama half. Oke. Nah, ada lagi nih, kalau dalam dunia kerja itu kadang kita melihatnya, si bos ini ya, si pimpinan itu, kadang melihatnya itu kalau kemudian ada karyawan atau siapa yang kemudian bekerja untuk dia, maka orang-orang dengan impostor tadi itu akan merasa bahwa lah sekarang ini lihat nih di dalam kita akan melihat dalam suatu point of view yang berbeda gitu ya. Sekarang gelas itu gelas dengan air separuh, maka dilihatnya sebagai apa? Ini adalah setengah penuh atau setengah kurang. Gitu. Akan kelihatan karena apa? Karena ini akan kelihatan terkait dengan motivasinya dia gitu ya. Apa yang sudah dia kerjakan itu kadang tidak ada maknanya, itu tidak ada artinya gitu. Jadi masih terasa bahwa oh ini masih separuh kurang, ya. Positifnya kurang. Gitu ya. Lower intrinsic motivation and job satisfaction, impair teamwork and communication, di mana ini adalah jadi may lead to excessive compensation, tadi overwork. Semua dikerjakan semua karena apa? Karena kalau tidak dikerjakan dia takut kelemahannya itu nanti akan tampak bagi orang lain. Ya. Nah, but also procrastination and risk avoidance tadi sudah diterangkan juga dengan Dr. Arjan ya, terkait dengan prokrastinasi. Impact of achievement pada impostor itu kemudian terjadi suatu nanti ajalah, decrease long term job retention, kemudian career satisfaction gitu, sudah jadi kepala sudah jadi ini gitu, merasa wah saya tidak pantas jadi begini jadi begitu gitu. Jadi enggak satisfaction gitu, karirnya enggak ini ya. Itu sama suatu ketika saat dulu waktu kongres di mana saya lupa ya. Saya ketemu sejawat dari Jakarta, dari Bandung itu. Kemudian mereka bertanya ke saya gitu. Dokter Roni masih KPS gitu. Ya. Oh masih. Wah ini ini orang yang paling ditakuti nih sama residen nih gitu katanya. Saya bilang, wah enggak apa-apa, enggak, impostor. Padahal di belakang sama, oh iya lo jelas, di belakang tapi. Limit visibility and recognition in the organization. Jadi ya jadi merugikan lah pada suatu organisasi. Nah, psychological and social mechanism pada impostor ini memang ya intinya bahwa di dalam suatu dunia kerja ini kalau terjadi seperti itu segera harus ditolong lah, gitulah. Nanti kira-kira begitu, kira-kira. Karena self doubt and cognitive distortion ini pada saat bekerja nanti akan mengganggu yang lain gitu. Karena kalau kita bekerja itu kan dalam satu tim gitu, tidak bisa kemudian satu dengan yang lain gitu. Satu tidak bisa kemudian soliter satu-satu kan enggak ya. Ada social isolation, reluctant to seek help bisa terjadi. Karena apa? Karena kalau seeking help maka nanti dia ketahuan. Wah, nanti buruk saya ketahuan itu. Impostor, merasa tidak pantas lagi. Ya, ini supportive organizational culture can buffer negative effect. Jadi apapun itu kalau kemudian terjadi fenomena ini di dalam dunia kerja maka harus dilakukan supportive organizational culture. Presence of mentoring and role model reduce impostor feeling. Ini yang agak susah ya. Mentoring and role model. It's difficult to find who can be our mentor and who can be the role model ya, in our work ya. It's very difficult, but we have to be a mentor. We have to be. Karena kalau tidak nanti dunia kerjanya juga tidak akan berjalan dengan baik. Inclusive leadership and peer support network are protective to impostor fenomena ini tadi. Oke. Ini hanya keterangan saja bahwa minority status, kemudian gender expectation, kemudian kompetitif, dan lain sebagainya. Ini keterangan saja, individual level tadi. Ya ini tadi organization level. Role of leadership, ini penting bagi Bapak Ibu, Mas Mbak sekalian yang nanti akan kembali ke masing-masing institusinya, yang kemudian nanti jadi pejabat di sana, jadi kepala rumah sakit atau jadi kepala dinas dan lain sebagainya, maka ini menjadi penting untuk melihat fenomena ini di dalam kerja dari karyawannya. Ya.
5 per minute, dokter.
Oh ya, serampung. Implication for daily life, impostor syndrome can affect work-life balance, family relationship, and personal well-being, encourage chronic stress, perfectionism beyond the workplace. Jadi memang pada dasarnya di dalam kehidupan sehari-hari ya kita akan merasa begini, tetapi itu juga akan harus diproteksi ya terkait dengan itu. Effect of impostor syndrome ini penting bahwa decrease job satisfaction and well-being. Kayaknya biasa saja bahwa saya merasa tidak pantas di sini, kayak sekali, 2 kali, 3 kali, nanti lama-lama jadi akan decrease job satisfaction ya. Kemudian increase work-related stress and burnout. Semakin merasa tidak pantas, semakin burnout. Ya. Lower work engagement and performance, negative impact on organizational citizenship, behavior, perfectionism and maladaptive coping, poor mental health. Ya. Jadi perasaan sebenarnya impostor syndrome itu hampir-hampir kalau di dalam bahasa Indonesia itu rendah diri, tapi rendah diri dalam artian yang negatif gitu ya, negatif. Ya, bukan rendah diri karena tidak pede ya, tapi rendah diri karena ragu-ragu gitu. Rendah dirinya karena ragu-ragu. Increase turnover, intention and retention problems. Ya, sampai pada impact of gender and minority status. Conclusion, impostor syndrome is a significant, seringnya adalah hidden ya, barrier to performance and achievement in the workplace. Ada di mana saja sebenarnya, termasuk di dunia kerja ya, di dunia kerja. Nah, multi level intervention, individual, social and organizational are needed for meaningful change. Ya, bagaimanapun juga harus ada suatu perubahan di dalam hal ini. Karena apa? Karena memang di dalam fenomena impostor ini perasaan tidak pantas, undeserved tadi itu menjadi hal yang hampir itu kok sering ditemui. Ya tidak hanya di lingkungan kerja ya, tapi juga di lingkungan pendidikan juga begitu. Gitu ya. Saya sering berkomunikasi dengan mahasiswa-mahasiswa baru, gitu. Itu juga begitu. Gitu ya. Kamu kok mau pindah kenapa? Gitu. Wah, saya merasa ini terlalu baik buat saya, ini terlalu keilmuan ini terlalu ini buat saya nanti. Padahal sebenarnya perasaan dia sebenarnya dia nggak mampu untuk berpikir di fakultas itu gitu kadang. Nah ini hal-hal yang mungkin harus dikenali di awal. Ya. Baik, mungkin itu. Thank you very much for your attention. And back to Dr. Winangku. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Dr. But first of all, I will let you hear in the offline participants to ask the question first. I give a limit for five questions from the offline and 5 from the online. Okay, I prefer to stand up. Raise your hand if you want to ask. Okay, Dr. Belian first ya. Okay.
Thank you, Dr. Winangko. Hi, Arjan. It's nice to meet you. My name is Berlian. Permisi, Dr. Oni. My name is Berlian. Berlian means diamond in English.
Why?
It's only joke. I have 2 questions. I heard about impostor syndrome before, and it commonly occur in Ph.D. graduate, as they only study about their own research. Apparently, after watching your slide, that impostor syndrome can also occur in medical field, and apparently it's a quite number about imposter syndrome. What I want to ask is how to differentiate between imposter syndrome and social anxiety or common low self-esteem. Is it? Do we have to meet some? I mean, all the criteria from your slide, previous slide. There are several number of symptoms of imposter syndrome. Do we have to meet all the criteria, or it only require 1 or 2 symptoms, to make it imposter syndrome? And the second one is that despite all of its drawbacks, I believe that imposter syndrome maybe has also a positive effect. What do you think about it? I mean, the positive effect, maybe it can be like the willingness to study more, or gain more academic achievement or something like that. I think that's all. Thank you, Dr. Win.
Okay, thank you, Dr. Brian. It's good question, I think, Dr. Arjan, because we haven't made any diagnosis in the DSM as well. So yeah, it's quite interesting. And the second one, what is the positive effect of the imposter syndrome?
Those are interesting questions. Thank you for that. There is it's not a yes or no with a lot of. It's also with other mental disorders. It's a sliding scale, and you have these like with depressions. Like, well, if you have 5 symptoms, then we call it a depression, etc., etc. It's also sometimes it's a negotiation between people who come up with the diagnosis. But we do know when somebody's depressed or suffering from depressive symptoms, and I think with imposter phenomenon, it's also it's a skill. But important thing, and also Dr. Ronnie showed it in his slides, that it's the difference between imposter and social anxiety and self-esteem. Low self-esteem and social anxiety are wider, I think, also in other situations, but they can still be situational. But imposter phenomenon is usually related to abilities in the workplace, or the people at my work, in that environment, they will find out that I am a fake. And then you can still be okay in your personal life. But I think if you would draw it like a graph, you know the Venn diagram with the circles, and there's an overlap. I think there's an overlap of social anxiety, low self-esteem, and perfectionism, and also with imposter phenomenon. I think you should look at it like that. The second question, whether there's a good thing about it, I know this also with perfectionism, that people say, yeah, but perfectionism brings me so much. It makes me work hard, and it makes me aim high. But then it's really important to distinguish which part of perfectionism is giving you that. It's good to have like the healthy part, work hard, be organized. But when you have this negative voice that if I don't get this goal, then I'm a failure, that's not really helpful. And the same thing goes then for imposterism. It's good to know, like, well, I am uncertain about these things. I'm not sure if I can do it. I have to study more, or I want to be really good at this kind of thing. That's okay. But when you have all these doubts, and it's all the time the same cyclists, and otherwise they're going to find out, they're going to find out, they're going to find out, that part is not helpful. But the first step, I think, is to realize, be aware that these things can occur, and they're very widespread in medical world and academic world. And that's why I think it's really important that we have this meeting here, because I didn't have such a meeting in the Netherlands yet, and here you're a lot faster with this. We still have to do that at the Vrije University. So I think this is the first important step. No, thank you.
Okay, maybe Dr. Roni, some insight from your side? Okay.
I think the positive of the imposter phenomena is, I do not know. I do not know. Because it's very, I can differ with our cultural background, yeah. The imposter and being humble in Java, yeah. Because we cannot show off, yeah. We cannot show our ability. We cannot. It's tadi taboo. It's kind of restriction in the Japanese culture to show our ability, to make someone know. Oh, we do anything, something like that. Yeah. But the positive is, I think the imposter can be like the titik awal to apa ya, kita bisa mulai untuk assess, ya, menilai bahwa bukan pasien, orang ini itu nanti perlu bagaimana. Karena kalau sudah, if we detect the impostor early, we can predict to the next what happen. Will be depression, it will be anxiety, or something like that, yeah. Okay.
Okay, thank you, Dr. Roni and Dr. Ayan. Dr. Pilihan, is enough? Okay, thank you. So the next one, Dr. Nia or Dr. Dita? Dita, Dr. Dita dulu.
Yeah,
Dr. Dita first.
Tes. Okay.
Oh yeah.
Good evening, Dr. Arjan, Dr. Roni, and Dr. Winoko. Thank you for this opportunity and for the wonderful talk that we had this evening. Dr. Arjan mentioned people with imposter syndrome tend to be afraid people find me as a fake. So my question is just simple. Do you think, or Dr. Roni also, do you think imposter syndrome is hugely overlapping with narcissism? And if so, would we approach it be similar, or do we is it like chicken and egg? Do we approach narcissism first or imposter syndrome first, or are they related, or is it like a Venn diagram? And what will you think about it? Because I've seen so many people on the internet mention about it being an overlapping. Thank you very much.
So Dr. Roni first or Dr. Arjan? Okay, Dr. Arjan first.
That's an interesting question, whether there's an overlap with narcissism, yeah. Well, when I think of narcissism, well, in the Netherlands, I'm not sure what it looks like here in Indonesia, but in the Netherlands, you recognize a narcissist because he's very outspoken and very obvious that I think I'm better than it. There's also like the hidden narcissist who thinks he's better, but doesn't want to tell other people. There could be an overlap, but I think somebody who's afraid of being exposed as a failure. Your question actually makes me start to think about it. I really have to think about it. It's interesting.
A bit confusing, right?
I never thought about it actually. What is your idea on narcissism and imposter? Is there overlap? Yeah, it could be. Yeah. What do you think actually? You came up with the question.
Well, my question would be like, how would we approach it, be it as someone, like maybe someone with imposter syndrome, maybe someone us as professionals, someone come up to us seeking help about, oh, I have imposter syndrome. How would you deal with, like, do you?
Well, the first thing is maybe it's important to give somebody a compliment that he's willing to ask for help. I have problems with the way I appear. I have problems with insecurity. I have problems with people finding out. And I think that's the same for people. People with narcissism don't usually go to a psychiatrist. They're too proud for that. Because then they'll admit they feel weak. So, but if somebody comes to you and says, "I have problems that I'm insecure, and I have problems with giving presentations, or I think I'm not good at this," then you're like, "Hey, this may be imposter phenomenon." I prefer the word phenomenon actually. But, that could be the case. And maybe there's some narcissistic part in this also, that could be. But I think that the way to deal with it is to give somebody praise for asking for help, and then to say, well, it's okay to be someone to learn, and you don't have to be perfect, and there's still things you can improve on, and be humble, and be thankful, and learn from your mistakes, etc., etc. And you can use like cognitive behavioral therapy for that if it's actually a therapy question. Yeah. Interesting question. Thank you.
Okay, next one, Dr. Nia.
Okay, thank you. Thank you, Dr. Arjan, Dr. Roni, Dr. Winangku, for the opportunity. My question is for both Dr. Arjan and Dr. Roni. I think when in the slides it's mentioned that a lot of the imposter phenomenon has to do with this kind of negative thinking, way of thinking. So I was, and it seems like a kind of cognitive distortion, which is discounting the positive, you know, I don't feel like I'm good enough, and if somebody praise me, it seems like that. So I was wondering, like, are there any studies which looked at how imposter syndrome can develop in the long term to anxiety or depression, which is diagnosable? And is there a place for like CBT techniques for that kind? And I was thinking, because imposter syndrome, people do not actually say that they're feeling like an imposter. How could we try to deliver these kind of things in the workplace or in academia, so that you know, we can start changing the perception of the individual? And the second point, I think from my own experience as a co-assistant, I think it is normal to feel like you're not good enough, I think, when you when you are immediately put into a position where you see everybody is at a skill on the higher end of the learning curve. You're going in there like at a low point. So what helped me, I think, was when I had seniors or actual specialists actually saying, you know what, I was like you, I was worse, you know? And then there's that safe space for debriefing, like when we had, you had difficulty, for example, delivering the baby. And I mean, what kind of interventions can we do, like preventive, to stop someone from developing actual diagnosable mental disorders from imposter syndrome? Maybe that's my question. Thank you.
Thank you, Dr. Nia. Who will answer first, Dr. Roni or Dr. Arjan? Roni, okay.
So your point is the diagnosis or the
whether there are any studies on how imposter syndrome could develop into depression and anxiety. Are there any cohort or something like that? Because there's a lot of negative cognitive distortions, I think, in imposter syndrome.
Like I mentioned about the, we know the difference between the, is it in a normal way or is it the maladaptive way? So when the imposter is come up in the academia or the workplace, so we have to recognize earlier before it goes to the severe feeling or something like that. So I think when the social or the environment is not supporting good enough, it could be make the imposter person become the anxiety or become the depression or become the perfectionism maybe. So I think the social environment is very important in this academia or the workplace. But we have to think about the role model and the leader. So we have to make sometimes who can make the change is the leader or the role model, who can make the imposter person to change their behavior or to change the distortion or to change everything or feeling the being impostor. I think that's
same as there like longitudinal studies, like for a couple of years for perfectionism and imposter syndrome phenomenon. They don't exist, only for like a couple of months. But it's a good question. I think it could be interesting to see how it develops in a couple of years if you follow a whole group of students. So that's an interesting research question. The other question about how to deal with it, I think cognitive behavioral therapy interventions can be helpful because it's about cognitive errors actually, and like acceptance and commitment therapy could also be an option. And from the institute point of view, I think if you know, like your supervisor or your mentors are not perfect, they're making mistakes, and if your supervisor says, well, I had to learn it too, and I thought it was a difficult thing too, those little things can be helpful too. So this talk I did give at my mental health institute to the residents, to also the part about my own kooschap, also for me to show them that I had these struggles too. And I think it's important for them to know that everybody has these struggles and to be open about it. I think those little things can help. But it's a culture thing that goes slow. Yeah.
Yeah, thank you, Mbak Nia.
Thank you.
I think Dr. Arjan already mentioned that the struggle session, when it's good as an example to know if your students or supervisor can talk together in a more natural way, so they can share if the student have a problem or something like that, they can share with the supervisor in a good way. Yeah.
There's also something else, and pardon my English, but that's the name of it. They call it fuck up meetings. This is just a name, sorry for my English. But in these FU meetings, people describe their fucked ups and what things they've done wrong, and it could be anything. And they have this also in offices and stuff like that. And they talk about failure and how they cope with their failure. That can be interesting also. Well, maybe you should choose a different name for that.
Thank you. Yeah, for the next question, we still have 2 more questions. Is there anyone? Oh, Dr. Rufi. Yeah.
Thank you for the opportunity. My name is Rufi. Sorry, my position is not very clear. Okay. My name is Rufita. I'm also a psychiatry resident in UGM. So I want to ask about, you mentioned about inability to internalize success, specifically about imposter syndrome. So is it happens the opposite way, which means it is it's easier for us to internalize failure in imposter syndrome, and what should we do about that, or why does it happen in the first place? Also, from Dr. Roni and Dr. Arjan also mentioned about cultural and financial background as something that is underlying the imposter syndrome. For example, if we are coming from a family that is poorer, or we are coming from a population which is more minority, we have a higher risk to experience that type of imposter syndrome. What can we do as academia, as someone working in psychiatry, if someone from a cultural or financial situation that has higher risk for imposter syndrome, what can we do to help them? Maybe that's my question. Thank you.
The question about when you're coming from a minority into academia or the medical world, it has to do with subtle differences. So it's about you thinking about how would you appear, what they would think about you, because you're a minority in a newer group, like in a higher level. But it also goes the other way around. So I know what you see in the literature is that when somebody from a minority group in the work environment, it could be that they're not going to ask that person for a certain job, or they're not going to ask that person for a certain task, or they use language that person doesn't understand, even though it's not consciously done. Sometimes it's unconsciously, but these phenomena or factors also influence the imposter feelings in that person already. It makes them bigger. So if you want to change it, you have to recognize it yourself, that you're experiencing it. But it's also important that the environment, that the supervisors, etc., also know what language they use. It's like minor. It's not racism, but it's like minor aggression kind of things, and you see it everywhere. Once you see it, you start to feel it everywhere. All the little details, little jokes people make, little words people like, and you have to be. You have to start to become aware of that's happening. But that's something you have to do at an institute level. But it's a gradual process. I hope that answers your question a little bit. But it is important, and I think the first step is to recognize it.
Yeah, I think it's cognitive distortion. We have to deal with it, because the distortion of this cognition that people who rise in a poor or minority society like that, we have to deal with distortion. Sebagai seorang psikiater ya harus tadi melihat bahwa ada distorsi kognisi yang perlu diperbaiki ini, karena kan ya walaupun mereka dari golongan poor gitu kan, ya tetap aja harusnya sama gitu, tidak merasa kemudian dia merasa tidak pantas gitu ya, itu distorsinya. Gitu. Gitu.
Okay, thank you, Dr. Roni and Dr. Aryan. One more question from the offline participants. Is there anyone? Okay.
Cek, oke. Assalamualaikum warahmatullahi wabarakatuh. Ya, perkenalkan saya Nanda, dari backgroundnya Magister Manajemen Rumah Sakit. Ini kebetulan ikut ke sini. Mohon izin untuk menyampaikan pertanyaannya dalam bahasa Indonesia, karena takut pronunciation-nya kepleset salah arti nanti. Untuk pertanyaan saya, karena kami bergerak di bagian manajemen rumah sakit, sebagai organisasi atau rumah sakit itu sendiri, di mana kita berperan sebagai environment dari seorang imposter, kita harus melakukan intervensi agar tidak memperparah fenomenanya tadi untuk menjadi depresi atau yang tadi ya yang disebutkan. Untuk salah satu langkah yang dilakukan sebelum memberikan intervensi adalah kita menyaring dulu atau mendeteksi dulu siapa aja teman-teman kita yang memang memiliki fenomena impostor itu sendiri. Nah, apakah ada sebuah alat screening atau indikator perilaku tertentu yang bisa digunakan oleh teman-teman dari bagian sumber daya manusia untuk menyaring teman-teman kita di rumah sakit yang memang memiliki impostor syndrome itu tadi? Terima kasih.
Okay, thank you, Dr. Aryan. Yeah, Dr. Roni, she's asking about, is there any tools or questionnaire that we can use to help diagnose or screen what is anyone in the workspace?
Well, there with a lot of psychiatric or mental disorders, there are like screeners, but there's not one way to diagnose the depression. For instance, you can screen somebody for depressive symptoms and severity, but you still have to see a clinician to know whether you're depressed, have a depression or not. There are scales for imposter, the Clance and IMS imposter scale, the SIPs, and there are some also modern versions of those. I think the CIPS. But if you just look for imposter scale by Clance and IMS, that's the one, and there's I think 3 others. I can send it to you if you send me an email. I can send them to you, and they can help you. But the most important thing is it's a scale, and it's more important to have a conversation about, hey, this is happening, instead of, well, you have it not. That's always difficult with screeners to say it's yes or no. But you can send me an email or ask for my email address. Yeah.
Oke, Mbak, nanti kirim email saja ke Dr. Aryan. Tadi dibilangnya kalau mau tulis di Google Impostor Syndrome Screen by Glenn, seperti itu. Oke, thank you. For the online participants, if there is any question, please unmute your microphone and show up yourself to ask to Dr. Roni or Dr. Aryan. Is anybody on the online participants? Yeah. Okay, if not, I just read this one, Dr. Arjan and Dr. Roni. This is the first question from Noor. The question is, how do you manage self-doubt and self-expectation while acknowledging our self-limitations? Is there any advice that you can give us on how to stay positive without being too permissive to ourselves? Thank you.
Also cultural.
Yeah. So how do I manage my self-doubt? Or do you manage?
How do you manage the self-doubt? Our self-doubt. Yeah.
Self-doubt. I think I'm not doubt.
Never doubt.
It's okay to have doubts.
Yeah.
I think it's okay to have doubts about what you're doing, but don't keep it to yourself all the time, and don't let it overwhelm you. If you have doubts about things, ask for help, talk to persons, try, be okay with making a mistake, practice, be humble, be thankful, look at what you've done, look at what you've achieved, don't focus on the negative. And also to come back to the previous question, I think we have a tendency to look at negative things as a human being. We have a negativity bias. It's very difficult to look at positive things. I think we should practice that more and more and more, to be grateful for the things that we have. Yeah.
Not half full, but half empty.
Or maybe we should get a smaller glass.
Oke.
Mungkin saya sedikit ya. Bagaimana cara untuk memanage doubt, keraguan tadi, doubt dan expectation itu sebenarnya ada satu istilah dalam bahasa Jawa itu ngono ya ngono ning aja ngono. Jadi sesuatu itu dikerjakan sesuai dengan porsinya, sesuai dengan sepantasnya. Itu untuk memanage bagaimana tadi self doubt and self expectation tadi itu kemudian tidak menjadi suatu proses yang berkepanjangan. Gitu.
Okay, thank you, Dr. Roni. I think the time is almost up, so I will choose one more questions, maybe from Dr. Afkar. Yeah, this is the last question that we choose, Dr. Arjan and Dr. Roni. How, from Dr. Afkar, how do we separate positive culture humbleness, like in Javanese culture, from problematic low self-esteem in IP? I feel that some of the questionnaire answer may be related to the culture.
Yeah, I think it's different between the positive culture and the low self-esteem in imposter problems or imposter phenomenon. Yeah, because the humbleness is to be humble is we realize we aware about what we are. But in imposter phenomenon, the problematic of low self-esteem is not recognized well by person who has the feeling. Yeah, so I feel that some of the questionnaire answer might be related to culture. Yes, of course, yeah, because we always related to the culture of this. Yeah, what can I do to improve my own job satisfaction? Job satisfaction, ya, for me ya. Kalau saya itu membedakan, memilah antara ini pekerjaan dan ini bukan pekerjaan gitu. Sehingga saat kemudian melakukannya itu bisa sama-sama puas gitu, satisfied gitu. Karena kalau kemudian kan dulu pernah ada istilah apa istilahnya itu, cintai pekerjaanmu gitu. Iya, pekerjaannya dicintai, tapi yang bukan pekerjaan juga dicintai gitu. Kalau kemudian hanya salah satu, maka salah satunya nanti akan dikalahkan gitu. Atau kemudian terlalu banyak yang dicintai ini bukan pekerjaan yang dicintai, pekerjaannya jadi low satisfied.
Dr. Arjan, that's alright. So sorry for the online participant that the question will not showing up. So this time for the closing. Okay, thank you so much for today, Dr. Arjan and Dr. Roni. Thank you for giving us good insight for this lunch discussion, which was very interesting. And thank you for everybody that's showing up in here, because it's not just yourself to attend this meeting, but to make more awareness for ourselves that imposter syndrome is around us, and we have to recognize this, and we have to cope with this one. Thank you so much, and have a good one.
Zoom juga kita foto bersama dulu ya. Ya. Mohon untuk ditunggu karena kita ada door prize yang akan kita bagikan untuk peserta. Jadi mohon untuk tidak lift dulu dan juga masih berada di ruangan ini. Untuk layarnya bisa tolong untuk dimatikan? Oh baik. Ya. Baik. 1, 2, 3. Sekali lagi. 1, 2, 3. Gaya bebas. Sekali lagi. 1, 2, 3. Baik, cukup. Oh gitu ya. Baik. Baik, sekali lagi kita foto bersama dengan, sebelum foto mungkin kita tutup dulu ya, atau kita umumkan dulu untuk door prize-nya. Oke, baik. Nanti kita akan foto bersama dengan peserta setelah pengumuman door prize, nggih dokter. Baik, untuk pengumuman pemenang door prize akan kita umumkan melalui layar berikut ini. Berikut pemenang door prize, selamat untuk 6 penanya terpilih. Dr. Berlian, Dr. Nia, Mas Nanda, Mbak Nur, Mbak Ifah dan juga Mbak Deskantari. Baik, silakan untuk dapat menghubungi panitia di nomor yang sudah tertera dengan Mbak Mita ya. Baik, terima kasih para hadirin sekalian. Tidak terasa kita sudah di penghujung acara. Terima kasih sebesar-besarnya kami ucapkan kepada narasumber Dr. Arjan, Dr. Roni dan juga moderator kita Dr. Winengku, serta seluruh peserta yang telah hadir secara daring maupun luring. Terima kasih untuk energinya, terima kasih untuk kebahagiaan kita hari ini mendapatkan insight yang baru dari para narasumber, semoga bermanfaat dan tentunya jangan lupa untuk tetap mengikuti lunch discussion untuk periode berikutnya, tentunya dengan topik-topik yang menarik sekali ya. Baik, terima kasih sekali lagi, sampai jumpa. Saya Resa Ayu, mohon undur diri. Terima kasih, selamat sore, wassalamualaikum warahmatullahi wabarakatuh, sampai jumpa. Baik, sekali lagi kita foto bersama. Nanti fotonya untuk para peserta silakan berdiri berada di belakang, kemudian narasumber nanti mohon untuk peserta silakan untuk dapat berdiri di meja sebelah sini di belakang meja masing-masing. Kemudian para peserta, para narasumber silakan untuk berada di depan meja peserta. Monggo Dokter Hamim foto bersama. Nggih. Oh iya. Baik, dalam hitungan ketiga kita pandu untuk senyum. 1, 2, 3. Sekali lagi. 1, 2, 3. Boleh gaya bebas? 1, 2, 3. Baik, satu kali lagi. Ada pengambilan video juga. Pengambilan video mungkin bisa satu suara dengan Viva Medica gitu ya. Sekali lagi 1, 2, 3, Viva Medica. Tepuk tangan untuk kita semuanya. Baik, terima kasih Bapak Ibu semuanya. Sampai berjumpa kembali di lunch discussion sesi berikutnya.